Good afternoon, everyone. It's my great pleasure to visit you and share my research with you today. So the topic of my seminar is the epidemiology and prevention of cell phone-related distracted driving. Like Dr. Sadiq mentioned, everybody is on their cell phone a lot, maybe at least a couple hours every day. And my talk will talk about how often people use that while driving, and what are the strategies we can reduce cell phone use while driving. Since this is an epidemiology seminar, so at first I will discuss epidemiology, go over the prevalence of cell phone use while driving. Then I will discuss some prevention strategies that can help us to reduce cell phone use while driving. So if you are an epidemiologist, you know the definition of prevalence generally is the percentage of people who use cell phone while driving during a certain period or at a one-time point. This is the most recent data from the US at the national level. This is the percentage of cell phone use while driving in the past 30 days. So it's a period prevalence. The survey is called a Traffic Safety Culture Index, which is an annual survey done by the AAA Foundation for Traffic Safety. Here we can see that handheld calling while driving is 38%. So it's 2 out of 5 drivers did that at least once a month. The percentage of reading a text while driving is equally common, is about 37%. When we look at complex tasks, handheld sending a text message, and this is more complex, the percentage is lower, it's about 27%. Then we look at hands-free use. This means you use like a Bluetooth on your car or any speaker phones, and that percentage is much higher, is 59%. So that includes hands-free calling or hands-free texting. Cell phone use is not just limited to calling and texting. And this is data from another national survey. This is from self-report. It's based on the self-reported behavior in the past 90 days. Here we can see that the percentage of calling, video call, or text is the most prevalent here. Is 62% in the past 90 days. Video calls, if you have an iPhone, you know, FaceTime calls, that's a video call. Today is also the time of social media, and a lot of people use social media, Facebook, Instagram, and also people use their apps a lot. So 37% of drivers use the phone for app use. And we have 27% of drivers that they took a photo while driving. And 26% of drivers, they watch a video, live stream a video, or recorded a video while driving. Yes, that can happen, and it's not that uncommon, I'd say. And 25% of people, read or send an email while driving, and 16% of people review a document while driving. So overall, 7 out of 10 drivers use their cell phone in the past 90 days nationally in 2022. So cell phone use while driving is really common, and I'd say it's an epidemic. But does it increase crash risk? Does it have any bad consequences? There has been many studies examining the association between cell phone use and crash risk. Here, I just present one seminal study, which was published about 27 years ago, published in the New England Journal of Medicine, which is a very renowned journal. This is an epidemiological design. It's called a case crossover study. If you are an epidemiologist, probably you've heard of this study design. This is to use all the cases, all the people who are involved in traffic crashes. And this is a design that that's proper for cause-effect associations with short induction dentist time periods. And one example is physical activity and heart attack. Here, we are talking about cell phone use and car crashes. For example, if we have a car crash at 5 p.m. today, and we look at the different exposure windows, we set the 10 minutes before the car crash as the exposure window, which is from 4:45 to 5 p.m. today, whether that person used the cell phone or not. Then we looking back in time, we look at the exposure reference time period, which can be yesterday from 4:50 to 5 p.m. But yesterday is a Sunday, so we may go back to 1 week earlier, so the last Monday. And we see how often the cell phone is used at that time period. And for the researchers in this study, they have the police accident reports. So they know the crash time. And also they got a collaboration from cell phone companies. They have the phone record. They can know when the phone call or text was made. So they can, examine the frequency of cell phone use during the exposure window and the exposure reference. And they find there's more cell phone use during the exposure window. And by using that, and they use some like a method that can analyze match data. It's called a conditional logistic regression. And they find that the odds ratio is 4, so which means cell phone use increases the crash risk by about like 4 times. So cell phone use is associated with crash risk. This slide is from meta-analysis. Is to summarize multiple studies. Here, the outcome is safety critical events. The safety critical events are minor crashes, also like when there are sudden change or direction of the vehicle, so hard brake. And these studies are called electronic driving studies. So basically, they have the camera in the car that can constantly recording driving videos. And then they can look at the videos to see what's going on about the task for the driver and if there's any safety critical events. From this meta-analysis, and then they specify each specific tasks, and they study the odds ratio associated with that task. And if the odds ratio is greater than 1, which means the risk is elevated here. And when we look at the task of dialing a number, the odds ratio is 4. And the 2 numbers in parentheses are confidence intervals. If they exclude 1, which means it's not statistically significant. If it includes 1, which means it's not a statistically significant. And the odds ratio for locating and answering a phone call, and the odds ratio is similar, is about 3.57. And then when we look at the task of talking, this means you already pick up the phone. The odds ratio is 0.89. And the 95% confidence intervals includes 1, which means is not a statistically significant. And when we look at text messaging and browsing the internet, which means, you need to look down and you need to like type the text. So there's a significant time away from driving. Your eyes are off the road, your hands are off the steering wheel, and the risk is much higher. Odds ratio is 10.3. So when we look at all cell phones together, overall, is associated with elevated safety critical events. The odds ratio is 2.7. In epidemiology, we talk about risk factors. We identify which subgroup is at an increased risk for certain behavior. This is one of our first published articles I'm going to discuss today. The first author is Lini, my former doctoral student at Ohio State University. And we collaborated with Dr. Ruth Schultz and Marisa Yeoman from CDC Injury Center. And we have Dr. Rebecca Andridge, who is a professor of biostatistics at Ohio State. Dr. Henry Xiang, my colleague at our nationwide children's hospital. The article is titled Texting and Emailing While Driving Among High School Students in 35 States, the United States, 2015. The article was published in Journal of Adolescent Health, which is a top journal in adolescent health and pediatrics. And the Lee won the Best Student Paper Award by APHA Injury Section. And actually, this paper was one of the 11 papers submitted. So it's I was really pleased for her. Our study objectives was to determine the prevalence of texting while driving among teens by state. And this is one of the studies to do that. And we identified state and individual level factors associated with texting while driving. In terms of data source and study population, we use the State Youth Risk Behavior Survey. Some of you might use this survey before. So this survey is a two-stage class sample design. So at first, for the state, they select the schools, then they select the whole classroom. And this is based on self-reported data. It's done every other year and managed by CDC. They ask a lot of behaviors. Cell phone use is one of them, and they also ask about tobacco use, alcohol use, and many other factors. Our study population was states that asked the question about texting while driving. The first time it was asked in 2013. Not all the states asked this question. To have the data, the response rate has to be greater or equal to 60%. If the state doesn't have that response rate, and we just cannot get the data, and the CDC consider it's not a representative for the state. Because like in the US, the earliest age can get a learner permit is 14 in some states. I know in Alabama is 15. So basically we included only the high school student that can legally drive. So all the students greater than age 14 or over. Our data included 35 states and about 200 students. Our outcome was based on one question. During the past 30 days, on how many days did you text or email while driving a car or other vehicle? And the response options are ordinal, like never, like 1 day or 3 days or 5 days. And then there's another option is all 30 days. And we did analysis, treat them ordinally. And here, for today's presentation, for simplicity purpose, I will just present the binary analysis. Statistical analysis, and we have about 12% of missing value and texting while driving. Nowadays, this is considered a big proportion. And we use multiple imputation to impute missing values. The model we use is called a fully conditional specification. This model is good for handling both categorical and continuous variables, and it's good for the complex data set. And here we have a complex survey. Our measure of association is prevalence ratio. In epidemiology, when the outcome is common, over 10%, we know odds ratio overestimates risk ratio. So we estimate the prevalence ratio, and we use the Poisson regression with robust variance estimate. And we accumulated the sample design using the weight, stratum, and the primary sampling unit. So this is the outcome slide. Here we can see that overall about 38% of high school students texted at least once in the past 30 days. For the age of 14 is 15%. Is, for 16% for age 14, 15, and it doubled at age 16, about 33%. For age 17 and 18, it's even higher. It's like can be half of the students or greater than half for age 18. In Alabama, you can get a full license at age 17, which means the teenager can drive unsupervised without their parents. They can drive at night, even like 1 p.m., 1 a.m. So we know that the teenagers have a higher crash rate per miles driven, and they are still learning their driving skills. But we can see that they are picking up the cell phone use while driving behavior. This put them at an even higher risk for crashes. We compare the prevalence of texting while driving by sex. Here is equally prevalent. It's about 37% for males and 38% for females. We look at the difference by race and ethnicity. It's higher among whites, it's 43%. For the other race and ethnicity, it's lower. They are about 30% for Black, Hispanic, or other races. This is to look at a map of the US, and there are different colors. If a state is blank, this means we don't have data from that state. This can be either that state didn't ask the question about texting while driving, or the state, the response rate for that state is less than 60%. That's the case actually for Ohio. So the response rate was lower than 60%. So the Ohio data is not available. If the state is colored gray, this means they are at the lower end of texting while driving. It's 26% to 39%. The highest we can see here is in the dark blue. There are 5 states neighboring each other. The highest is South Dakota is 64%. The reason for this is like in South Dakota, you can get a learner permit at age 14, so really young. And by age 16, they have a full license. They can drive unsupervised, and then they use cell phone a lot. The lowest is Maryland, is about 26%. When we look at Alabama, it's in the middle, is from 40 to 49%. We also examine other, safety behaviors. Here is the seatbelt use. If a person use seatbelt all or almost most of the time is about 36%. And we can see if a person, doesn't wear seatbelt often, their percentage of texting while driving was higher, 51%. Here we can see that alcohol use is a strong predictor for texting while driving. As we know that drinking and driving is against the law, is against the social norm. So if a person, did a drink and driving, he or she would care less about texting while driving. So it's about 87% of them. And this is the chart for all the factors together. Is from our multivariable analysis. And here we can see age 14 and 15 compared to the reference group, which is age 16. They were 50% less likely to text while driving. On the other hand, for age 17 and 18, they have increased risk for about 50%. We see equally risk for male and female. And we are seeing here that for Black and Hispanic, they are 30% less likely to text while driving relative to whites. And we can see the 20% increased risk for infrequent seatbelt users. For drinking and driving, the risk ratio is about 1.91. Okay, if a person has ever riding with a driver who does drinking and driving, there's higher risk for that. Here we have another state level factor is the driver percent. It's like a lower percentage of drivers or higher percentage of drivers. We use that measure to measure the state social cultural factors and regularly contacts about, if and when an adolescent begin driving. And we see if there are more drivers and maybe loose regulations, we see higher texting while driving. In sensitivity analysis, we did a complete case analysis. We only analyzed the data, that's reported. And we mentioned about that 12% of people don't respond to that, right? This missing might not be missing at random. So if you texted while driving, you may not report that. You just don't answer that question. This is called social desirability bias. And we replace all the missing value to yes. And we find that the prevalence ratios doesn't change substantially. And also the direction of the association didn't change. In conclusion from this article, we found that texting while driving varied widely across states. There's a twofold difference. For ages 17 to 18, white, race, drinking and driving, and infrequent seatbelt use are associated with texting while driving. So our article has been reported by numerous news agencies worldwide. Here, I list some news agencies with their potential readers, and we were reported by Yahoo. The potential viewership was about 200 million readers. It was recorded by Forbes, WebMD, Business Insider, and Reuters. And the aggregate readership for our article is over 400 million people. this combined online news, blogs, print, and television reports. So for second part of my seminar today, I will talk about prevention strategies. In injury prevention, we discuss 3 E's. The first E is education. The second E is enactment and enforcement, means passing cell phone laws, and the police officers can stop drivers for cell phone use while driving, the enforcement. Our study team has done quite some research in policy evaluations. We have a success story about seatbelt use and seatbelt laws. Back to 1983, there was no seatbelt law, and the seatbelt use for front vehicle occupants was low, about 14%. In 1984, New York State was the first state to pass the law. By 1996, 49 states passed the law to require front seat vehicle occupants to belt, except New Hampshire. And from this chart, you can see over time, the seatbelt use increased. And by 2022, 92% of front seat vehicle occupants use their seatbelt all the time. So now it's against the law and also against the social norm not to use a seatbelt. So this chart to show some history of cell phone laws. The first seatbelt law was enacted in 2001. That's in New York State. At that time, calling is very common. So that's just ban calling while driving. And then in 2005, Connecticut was the first state to ban both calling and texting. And at that time, there has been some texting going on. 2007, that's in Utah, that's the first state to ban any handheld cell phone use. So you cannot just hold your phone, that's first state. And then in 2008, there are like states banning just texting. At that time, texting is becoming popular. And there's one state banning texting and data access using the internet. We can see that from 2010 to 2019, there are many more states enacting cell phone laws. And there has been shifting going to comprehensive handheld bans that's in green here. And also there are many more states banning texting or texting plus data access. So they are in the purple or red. This is a map to show the different type of cell phone bans as early as January this year. So basically we can see there's about like 21 green states. So they ban calling, texting, and data use for the cell phones while driving. And we have one state, Montana, doesn't have a cell phone ban. And we see a majority of states are purple states. They ban like texting. They also may ban data access, but they don't ban like specifically ban calling. And we have 3 states, New Jersey, Connecticut, and Rhode Island. They ban both calling and texting. Here we note that Alabama and Ohio, they mainly just ban texting while driving. Next, I will discuss our second article. And this article was in collaboration with some researchers, Ridamir from University of Toronto, and also Robert Foss from University of UNC at Chapel Hill. The article is titled ban on cell phone use while driving and traffic fatalities in the United States, published in Epidemiology, one of the premier journals in general epidemiology. Our study population was about 600,000 fatally injured persons. We are talking about the fatalities, the most severe traffic safety outcome. Among them, we have about 350,000 drivers. We examined only drivers aged 18 or older. We excluded the persons under age 18 because they going through a different system. It's called gradual driver license loss. That makes that analysis more complex. And there are also another type of loss governing them. It's called a young driver cell phone loss. So we want to make this analysis simpler. So we focus on adult drivers and adult vehicle occupants. And we examined data from 1999 to 2016. And then we had data from all 50 US states. And note here that we dated back to 1999. Remember that the first year the cell phone law was effective was 2001. So we want at least 2 years data before that. So we want some baseline data. Our study design is called longitudinal panel design. So we basically, link the population estimates, traffic fatalities, the prevalence and the characteristics of cell phone bans, and the various confounders by each state year and quarter. So our exposure variable is cell phone use while driving bans, and the outcome is traffic fatalities. We control other traffic safety laws, seatbelt laws, speed limit, impaired driving laws. We also control some socioeconomic factors, unemployment rate, income. If there's a high unemployment rate, because people don't have much money, they just drive for essential activities, and this make them, safer on the road. They're not driving for parties, driving to the bar. And over time, we know that cell phone increased over time. So we had a variable about cell phone ownership. We also include travel factors such as vehicle miles traveled, gasoline price, and also we include the percentage of rural land out of all the roads, because the rural road can have like a high speed crashes and there's less EMS response time. So we control that variable. Also, we have the year, state and quarter as fixed effects. We use negative binomial regression, which is the regression model for read data. And our outcome is a quarterly count of fatalities. And we use population estimates. So in this way, we estimate the rate ratio. And we used generalized estimate equation this way because we have repeated measures from each state. And this is the outcome table. So we look at driver fatalities, and we have the reference group is no all driver cell phone bans. Here are 5 types of cell phone bans: calling only ban, texting only ban, text plus data ban, calling and texting ban, and a comprehensive handheld ban. If the read ratio is less than 1, and also the 95% confidence interval exclude 1, which means it's a statistically significant. Here, what we can see is only comprehensive hand ban was effective. Why is it effective? Because it's a broad ban and it sends a clear message that cell phones cannot be handled at all while driving. And it is also easier for police officers to stop drivers for cell phone use while driving. So easier for enforcement. When we look at non-driver fatalities, here we are talking about like passengers or motorcyclists or pedestrians. They are the indirect target population of cell phone loss. From this slide, we see that the already ratios are close to 1, and they are not statistically significant. We also look at different characteristics of cell phone bans. Particularly here, we look at comprehensive handheld bans. There's 2 categories here. One is called primary enforcement, which means the police officer can stop the driver just for cell phone use. And then there's secondary enforcement, which means if the driver was using a cell phone, but there's no primary enforcement citation such as speeding, you cannot stop the driver. Only the driver is caught cited for speeding, a primary offense, then the police officer can additionally cite the driver for cell phone use. And here we can see that primary enforcement is statistically significant. And we also want to see the time effects, right? It's like the cell phone law has an immediate effect or the effect stays over time. And we compared the ratios for less than 1 year, 1 to 2 years, or 2 years and more. And we can see the ratio are similar. This means when the law is inactive, it's effective right away, and the effect stayed. We did a sensitivity analysis. So we did a mixed modeling with random intercept and random slope. This to consider variation in the baseline fatality rates, and also to allow that the effect of the cell phone ban vary by states. And we find that generally the ratio stayed about similar. And we also excluded like 3 large urban states that's early beginning in the cell phone law, like New York State, California, New Jersey. They just banned the county at that time. You exclude that 3 states. And another type of analysis, we know that 2008 to 2009, there's an economic recession. Because of the recession that affect driving. So in coincidence, there are many states passing cell phone laws after 2010. So we focused on that period. We compared 27 states with cell phone bans enacted in that period. And we also compared a comprehensive handheld ban with everything else for that period. Last, in sensitivity analysis, we excluded non-alcohol related driver fatalities because alcohol is a significant contributor for traffic fatalities. We excluded that potential factor. Based on this sensitivity analysis, generally the ratio for cell phone loss didn't change substantially. Now I'm going to talk about the last article. And this is in collaboration with Dr. David Schwabel here at the UAB. And the article is titled Short-Term Impacts of All-Driver Handheld Cell Phone Bans on High Schoolers Texting While Driving, Quasi-Experimental Analysis of Illinois and Georgia. It's published in Accident Analysis and Prevention, a premier journal in safety field. And in injury epidemiology, we don't call it an accident, which means nobody is fault. It just happened by chance. And we call it a crash. But this journal has a history, and so they still have used the word accident here. Our study hypothesis based on the previous research, and our research and other people's research have found that all driver handheld bans were associated with less handheld phone use and fatalities. So they are effective. And there has been little evidence that all driver texting only bans are associated with less texting or fatalities. And also for the young driver cell phone bans, generally they ban just cell phone use for drivers under age 18. They include like all cell phone bans. You cannot even use for hands-free use. There also has been studies showing they are not effective. So we just hypothesized, right? For states, we just strengthen them from all driver texting only ban to all driver handheld ban. That actually might reduce teen texting while driving. That's our hypothesis. And actually this applied to about 1/3 of US states. Our study design is called a quasi-experimental design. This is borrowed from some design in economy. It's called a difference in differences analysis. This is commonly used for policy evaluations. So you have the intervention states, then you have the control states. So we have 2 intervention states, Georgia, and we choose the North Carolina as the control state. They are from the same census division. And we have the intervention state, Illinois, and we have the control state, Michigan, right? So if you look at this chart here, we're going to have like 2 differences. And the first is just before intervention, we have the red line that's the intervention state, and we have the green line that's the control state. And then we have the difference in baseline outcome measure. That's one difference. And then after intervention, you can calculate the outcome measure for the intervention state, and then the between intervention and the control state, that's one difference. Then if we subtract this one difference from the other, it's called a difference in differences. This part is the intervention effect. Okay, so basically we assume the constant difference in the outcome, and we have the unobserved counterfactual outcome trend for the intervention group using the control group. In terms of study data, we use the State Youth Risk Behavior Survey, and we have the data from 2013 to 2019 for Georgia and North Carolina. Because like Georgia, they don't have data for 2015 and 2017, so we use the 2013 data. And for Illinois and Michigan, we use 3 cycles. So this is the equation for difference in difference analysis. We are talking about expectation of yi. Yi is indicator whether the subject texted while driving. And we have the law variable. This is the indicator whether the law was in place when subject I responded to the survey. And we control the yearly fixed effect. We have the state fixed effect that control for unobserved time invariant confounding. And we have a vector, which is a vector of demographic variables here. They are like age, race, and grade. No, like age, sex, and grade. Yeah. This is the outcome chart. The dark line is for Georgia, right? We can see that for Georgia, actually, after intervention, the texting while driving decreased, and for North Carolina, actually it increased. So if weren't there's a cell phone or driver handheld ban, for Georgia, the texting while driving among high school students might increase. Using the difference analysis, our study identified that there's a 11% reduction in texting while driving for Georgia due to the all driver handheld ban laws. When we compare Illinois with Michigan, Illinois is in the dark, and Michigan is the light line. And we can see like for both states, there's a reduction. And for Illinois, the intervention state, we see a more significant, more higher magnitude of reduction. So we've done quite some publication and research in policy evaluations. And we also did some policy advocacy. So this is a photo taken from back actually in 2021 when I given expert testimony for the cell phone law at Ohio House to talk about our research, discuss the danger of cell phone use while driving, and recommending all driver handheld ban to the state legislature. And it definitely took a village, took a lot of people, organization efforts, and it went through 2 cycles. One cycle is 2 years in Ohio, so 4 years. And finally, actually last year, the law passed. And this is the government website that, telling citizens about the law. So now actually before was just ban texting. Now actually is more broader. Bans, generally they allow a single swipe to use the phone. And also is a primary enforcement. So here the language, if an officer sees a violation, they can pull you over. This means it's a primary enforcement. They can just cite you for cell phone use. And that's the new law in Ohio. There's one exception we hope to add in the future. It's like if you use a single swipe to answer the call, but if you hold your phone to a ear, it's still allowed. So we cannot say it's that comprehensive handheld ban in Ohio. I'm also involved in the policy committee for another organization. It's called Association for the Advancement of Alternative Medicine. So it also took 2 years. I led the effort to draft the cell phone related to track the driving position statement. It was just adopted in June earlier this year. So basically, this is recommending, the all driver handheld ban in the US and worldwide, and talk about review the scientific evidence, and also making recommendations, talking about the danger of cell phone use while driving. So at last, I want to talk about one of our current grant. We talk about 3 years in injury prevention. First year is education. Second year is enactment and enforcement. The last year is engineering. So the technological solution to reduce cell phone use while driving. And this is currently a randomized trial on mobile technology to reduce young drivers' cell phone use. So we wanted and we are recruiting 300 young drivers aged 18 to 24 years old. And they are randomly assigned to 3 groups. The first is the app group. We have a commercial app that can automatically block cell phone use while driving when it detects the vehicle is traveling more than 10 miles per hour. And it does allow hands-free cell phone use. And sometimes, the person might be a passenger or using a public transportation. There's a button for passenger override mode, so that a person can use the cell phone. Yeah. And then we have the driving mode arm. If you have an iPhone, the do not disturb while driving mode, that's the driving mode. And then we have the app as a sham mode. So it doesn't block any phone calls or text, but just recording everything in the background. In terms of outcomes, the app can track calls and text. And we also have a device, it's called a drive cam. It's a palm-sized device, it's a video camera. It can be installed on the windshield. It can use machine learning and AI to capture handheld cell phone use. And also it can capture high-risk driving events. When there's sudden change or direction of the vehicle, it records 10 seconds of video, so we can know what's going on, whether cell phone use contributed to that event. So this is one of our study coordinators to test the device. I'm going to place them here. So you can see there's recording of all the events and the speed. And it's automatically recorded, just captured by the camera using machine vision. The other is at night. I acknowledge my collaborators, and many of them, without them, I cannot, contribute to all these articles. And I only acknowledge my funding. So at NASA, I will just put out a slide like, our team is recruiting a PhD student and postdoctoral fellows. If you are a student or you know somebody, and please talk with me. And this is my contact information, and thank you so much.